think that when you're dealing with systemic racism, everything comes at you in different ways.
It has been a turbulent and traumatic year for Indigenous communities across Canada. From the discovery of mass unmarked graves at former residential school sites to systemic racism in healthcare laid bare. Following the death of Joyce Echaquan at a Quebec hospital, communities are hurting and calling for massive and systemic changes come the new year.
The different kinds of systemic racism that we face throughout the last year has been even more present. There's always going to be those that don't want to address it, and there will be those that want to be part of the solution. And I think that's where we have to put our energies, because if we have something like Joyce's principle, then we can push different hospitals to try to adopt it.
Joyce's principle is a call to action aimed to guarantee to all Indigenous people, without any discrimination, the right of equitable access to all social and health services, as well as the right to enjoy the best possible physical, mental, emotional, and spiritual health. This has not been adopted by the Quebec government, which still does not recognize systemic racism.
The fact that this year we had our first day of reconciliation, but we did not get any support from the provincial or the federal government, any recognition about it or participation. I think that speaks volumes, right?
But some Montrealers have taken matters into their own hands to help Indigenous people feel safe in healthcare settings.
People do is they come up with their own solutions. So I've had two different Indigenous people that are affiliated with McGill University and are creating different sort of committees that would sit on different hospitals to ensure that, Indigenous patients are respected.
But advocates say the pandemic has brought about many different challenges and exacerbated many problems.
I think that the pandemic has increased the numbers of homelessness, but in terms currently of COVID responses, there are less services for the homeless.
Despite new hurts and old wounds being ripped open, some say there's still some progress being made. A month ago, a school for First Nations leaders was launched, a first of its kind. And the Quebec Order of Nurses announced in November that it wants to address systemic racism in healthcare by fostering nursing practices that promote humility, safety, partnership, and trust.
We're moving in the right direction. Ideally, we would be there now, but I think that the efforts are being made, and people are wanting to be part of the solution.
In Montreal, Brittany Henriques, City News.